Good evening. We begin with the return of Medicaid work requirements to Arkansas. They're back 7 years after a federal judge ended a similar program that required able-bodied Arkansans to work to keep their coverage.
But critics warn the new work requirements could leave people uninsured before the rules are even finalized. Channel 7's Autumn Fulch joins us now with a closer look at what's at stake. Autumn.
Well, Chris and Beth, Medicaid expansion has long been a lifeline for Arkansans, but a new soft launch of work requirements has many people worried. Today, we hear from a lawmaker and residents about what these changes could mean for families across the state.
Starting July 1st, healthy adults who are enrolled in the state's Medicaid expansion program, known as Our Home, will face a new requirement. They must work, volunteer, or attend school at least 20 hours per week to maintain their coverage, but penalties for noncompliance won't go into effect until January 1st. State officials say their soft launch of the requirement will help recipients learn how to report their qualifying activities. Critics warn it could do more harm than good.
People would actually lose their jobs because they lost their health insurance because they didn't comply with the red tape. If you're implementing it now without the administrative structure even being in place, then the impact will be a lot more harmful.
Democratic Senator Clark Tucker says clear communication is key. He says automated systems like wage records and SNAP information will be relied on, but they won't capture caregiving, volunteering, or other ways people can meet the work requirements, and that could cost Arkansans coverage that's essential to their health.
Medicaid is just critical. I mean, I think it's more critical for Arkansas than just about any state. I mean, I think people will die if they don't get the health care they need. They don't have access to it.
Tucker says coverage losses don't just hurt individuals. They ripple through families, hospitals, and the wider healthcare system, especially in rural areas where options are limited.
With these new rule changes, we're going in the wrong direction. We're going to have uninsured adults lose coverage, and that's going to be bad for them, but it's really going to be bad for everybody. The rural hospitals will suffer, and the rest of our insurance rates will go up.
Even though the state says it's working to prevent errors, some residents remain concerned about access to care.
So many people only get a job just so they have insurance. They don't get child care, they don't get regular checkups. Like I said, pregnant women don't get regular checkups. It's just vital. And people that have chronic disease that are suffering, they don't get health care.
Well, Governor Sanders has argued that the state should not pay to subsidize health care coverage for adults who are able to work. Her plan also offers exemptions to the work requirement for pregnant and postpartum women, disabled veterans, caregivers, and those with special medical needs. On your side, I'm Autumn Fulch.
Autumn, thanks so much. We'll continue to follow these Medicaid changes closely to see how they impact families across the state.